everybody. Good morning, good evening, wherever you are in the world. Welcome back to DunsHospice, okay? My name is Nurse Dawn. I am your RN registered nurse. Thank you for being here with me. Welcome. I am always so happy to see y'all. You guys, as you come in, let me know how my sound is, okay? Because sometimes my sound is not too good. So I count on you to let me know how my sound is, okay? Okay, guys, let me know how my sound is. Come on in. Oh my God, I miss you guys so much. I miss you, my hospice family. You guys are awesome. I know that I have not been live in a few days, but I have been posting contents, okay? So I hope that you enjoy, I pray and hope that you have been enjoying the contents that I have been putting up. I'm just getting my notes. For us, okay? I want us to talk about hospice care, and what we need to know regarding hospice care. Okay, my beautiful people, my beautiful, awesome people. As you come in, guys, please let me know your name. If you can let me know your name and also let me know where you're from, I would greatly appreciate you. And of course, let me know. Hello, my hospice family. Come on in. I see some of you are already here. I'm so thankful. As I mentioned, I'm so thankful to each and every one of you. Welcome to DunsHospice. My name is Nurse Dawn. I am your hospice registered nurse. Okay. My name is Nurse Dawn. Welcome. Let me know, my beautiful hospice family, if you have any questions about hospice care. All right. My name is Nurse Dawn. Come on in, my hospice family. We are going to talk about all things hospice, all things end of life care, and what we need to know, okay? What you need to know as a caregiver when you have somebody who is, under hospice care, when you have somebody who's dying, when the doctor tells you that your loved one is dying and there's no cure for your loved ones, what do you do? Okay, what do you do when the doctors say that, your mom has 6 months or less to live, your dad has 6 months or less to live, and that there's no cure for the illness, okay? Because I myself, guys, I think I've shared this before, but my own father, who I love dearly, okay, because I'm his only daughter. My dad has 5 boys and 1 girl, which is me, and I'm the oldest too, okay? So my dad is under hospice care. It's really hard on me, and it's hard on, the family, his loved ones, but I'm so thankful that there is such a thing as hospice care. I'm so thankful about hospice care. So please, we are going to talk about it, okay? If you have not done so, please subscribe to this channel to be part of the family. Let's see. You said, I bet people are dying to talk to you. I'm not sure if that's being sarcastic or not. I don't know how to take that comment, but I am a positive person. I'm going to take it in a good light. Good light. Lucy. I love my internet people. Lucy, you are hilarious. Lucy says, how is your skin perfect? I don't know, Lucy. You know what it is, actually? Let me tell you my secret, okay? Water. I drink 2 liters of water a day, Lucy, okay? I drink a lot of water. And also, Lucy, to have good skin, at least for me, I don't smoke, okay? And also I use Dove, D-O-V-E, okay? Dove soap is really good. It's good for your skin, it's good for your face. Use Dove, okay? Stay away from the sun and stay away from the sun. So those are my 3 recommendations, okay? Drink plenty of water, at least 2 liters a day. Stay away from the sun, stay away from alcohol and smoking, and use Dove soap, okay? All right. Hi, everybody. Come on in, guys. Please come on in. Hi, Rosa. Hi, Oh, you you guys have some very interesting names. Apologies if I'm butchering your usernames, but hi, everybody. Come on in, please. We are going to talk about hospice care, okay? My name is Nurse Dawn. I am a hospice registered nurse. Yes, I am a real hospice registered nurse. So yes, guys, like I was saying, this video that you're watching right now, we are going to talk about what you must know about hospice end of life care. And as I mentioned, my father, okay, who I love so much, he's currently under hospice care, okay? So use me, guys. I completely understand what you're going through. Anybody out there who's taking care of a loved one under hospice, trust me, I understand. So what you must know, the number one thing, okay, if anything, from my experience, okay, being a hospice since 2012 for over 10 years, from my experience, okay, like the number one thing that I would like families to know is that hospice, the word hospice itself is not the reason why your loved one is dying, okay? Hospice is not there to kill your loved ones. We are there to manage symptoms, okay? All right, guys? So that's the number one misconception. That's like the number one thing that I want us to understand when it comes to hospice. Like, I want us to know that, you know, hospice is not the reason why your loved ones is dying, okay? Like, so many times I hear the family say, oh, I want them to be off of hospice. They're dying because of hospice. Or they'll say things to me like, and also to my colleagues, shh, don't use the word hospice, okay? And I want us to understand that hospice itself, it is a service, okay? It's a service that we provide your loved ones at end of life. When your loved ones, okay, when our loved ones, like your dad, your mom, your brother, your sister is dying, it is a service that we provide to them. All right? Hospice is not the reason why the person is dying. It's a disease, okay? It's the disease, it's the illness that is killing our loved ones, okay? Not hospice itself. Does that make sense, guys? Like, I want you guys to understand that, okay? From now on, it's like a big misconception, okay? Because hospice is a service, all right? So that being said, you might be asking yourself, like, how does somebody qualify, okay? Who qualifies to be under hospice? How does somebody get to be under hospice? And the misfortunate thing is that, okay, hold on, guys, hold on one second. Commercial break. All right, guys, I'm back. I had to turn on the fan. I was getting hot. Okay, so the number one thing to know how somebody get under hospice care, it's by your doctor. Okay, your doctor is the one who has to say that the illness you have, there's no cure for the illness that you have, and that the best thing to do is to go home and be comfortable. Okay, so hospice care is when the doctors say that, like, for example, if your loved one, has cancer and they've been receiving chemotherapy, they've been receiving, radiation, they've had surgery, and nothing is working. So your doctor may have a conversation with your family, okay, with you. If you're the healthcare proxy, the doctor will have a conversation saying that, I'm sorry, but Mrs. Smith is not getting any better. There is no cure for Mrs. Smith. The best thing to do is to go home and be comfortable, okay? And that's when hospice as a service comes in. So the doctor will say, well, we know this hospice company. We know this hospice company, and we're going to have the hospice nurse come to your house and explain more about what services, what resources they can offer to you. Does that make sense, my beautiful hospice family? Rosa, thank you, Rosa, Roso Fafa. Thank you so much. Thank you, my dear. My hospice family, also, I want you guys to know that I am on TikTok. Okay, I'm on TikTok. I'm also on Instagram. All right, all under DunsHospice. So if you have not done so, please be sure to subscribe, okay? Subscribe. Follow me. Follow me on TikTok, and also follow me on Instagram, okay? And if you have not done so, please subscribe to this channel to be part of the family. Thank you, Roso Fafa. I see that you just subscribed. Okay, I just got a new family member. Ooh, I'm so happy whenever somebody follows me. And make sure you hit the notification bell so you'll know next time I go live, okay? Because I want to go live and to interact with you guys. If anybody who's watching, if you are in the medical field, okay, like for example, if you are a nurse, if you are a CNA, if you are a doctor, or an LPN, whatever the case is, please follow. Let's be together. And especially if you are a caregiver, or somebody who's a caregiver who's taking care of somebody who's dying, this channel is definitely very useful. Okay, guys. All right. So yeah, like I said, what I wanted you to know is that, let me see, I have my notes, guys. As always, I have my notes. I want to make sure that I am covering everything, okay? I don't want to miss anything that I want to say to us. Okay. Let's see. Yes. So it's not the word hospice that's killing our loved ones, okay? It's the disease itself, and that the doctor is the one who's going to come in and refer you to hospice, okay? Now, the other thing that I want to say is that once you are under hospice, okay, we as a hospice staff, we do not push for you to die, okay? Like, we do not hasten the death process, okay? Because so many people think that, oh, hospice, okay, the nurse will just come in and give you a bunch of medications, okay, to cause you to die faster. And that is a big no. All right, like the nurse does not come in, like we don't want to speed up the process, okay? Not only is it illegal, all right, it's illegal, we have our license to maintain, but there's no way we want, to speed up the process. No, that is a fault. That is false, okay? Because I mean, hospice is a business, first of all, okay? It is a business, it is run by a company, okay? Like, it's a business. So, the company wants to make money. So, they want patients, we want our patients to stay, to live as long as possible. So, like, not only is it very like illegal for us to try to, because I have had patients, okay, okay, who say, oh, just kill me already, kill me, give me something to die, I don't want to live anymore, okay, this quality of life is my quality of life is poor, why am I here, like it's very heartbreaking, it's very heartbreaking as a nurse to hear, or as a family, to hear, your husband, your wife, your mom, your dad saying, I don't want to be here no more. I don't want to be here no more. I don't want to live anymore. Kill me, make the pain go away, make the suffering go away, But I really want to let you know that the hospice staff, the hospice nurse, the hospice doctors, we are not here to speed up the process, okay? We are not here to, make sure that you die faster. Absolutely no. Absolutely not. That is not what we are here for, okay? And you may be asking yourself, well, then Nurse Dawn, why are you here for? Like, what is the purpose of the hospice team? And if you did not catch it, once again, the purpose is to manage your symptoms, okay? I want you to know that hospice team, the hospice nurse, things like that, we manage your symptoms. We make sure that you are comfortable at end of life, because so many people, okay, so many people wants to die at home. Everybody that I talk to would rather die at home in their house. Like, for example, okay, I spoke to my dad even before he became, like really, bad towards his diagnosis. Like, even before his diagnosis, his disease progressed. Him and I, had a conversation in the beginning. I said, Dad, what are your wishes? What do you want to happen? And he told me, like, as his healthcare proxy, as his daughter, as his healthcare proxy, he tells me that, he does not want to die at the hospital. He wants to die in his home, okay, surrounded by his loved ones, surrounded by his family, all right, without any suffering. And so that's what, we are doing. That's what I'm doing. And so that's what hospice can do for you, okay, my caregivers. So rather than, taking your loved ones to the hospital, if they're having difficulty breathing, if they're having infection, whatever the case might be, the nurse will come into your home. The nurse will teach you the proper procedures. The nurse will teach you the proper techniques to do to take care of your loved ones at home, so that, if they develop, for example, if the person develops pneumonia, okay, you don't have to run to the doctor's office with them. You don't have to call 911, okay? The nurse will take care of it. If the person is in pain, if they're screaming in pain, like say it's a weekend, okay, and you don't have any medications, or it's a weekend and all of a sudden, your mom's pain is getting worse, rather than rushing them to the ER, just call the hospice office, okay? And the hospice nurse will be there, okay? Does that make sense, my hospice family? Talk to me, talk to me. Like, who has a question? Who among you watching has a question for me regarding hospice care? Regarding what I just said about this topic. All right. So those are like, that's what I want to talk to us for now regarding, you know, what I want you to know about hospice. Like, those are some of the common, I guess you could say, misconceptions that I hear about hospice, about end of life care. Okay. And I just wanted to come out here and talk to us about it. Okay. So if you guys don't have any questions for me, I think I'm going to go. Okay, I think I'm going to go. But like I've said, please subscribe if you have not done so. Subscribe and hit the notification bell so that you'll know each time I upload a video, okay? And so that you'll know also when I'm live, so you could ask me any questions. Okay, my hospice family, it's always a pleasure to see you guys. I love you with the love of Jesus Christ, okay? Come back. I'll see you in the next video. All right, take